All set. So, so you want to go by Maj?
Maj is great, yeah.
Maj Berryman.
Mhm.
So okay, that'll be easier.
Yeah.
What's the? I mean, Mahjida. I mean,
Mahjida.
Where's that come from?
So my dad went to high school with a woman named Mahjida, and he really liked the name, and just kind of adopted it. Of course, she's like Lebanese, and her family is, just more in that culture, and I'm very white. So it's kind of a mismatch for me, but yeah, it's okay.
Yeah, that was interesting because I hadn't met you before.
Yeah.
I know of you, but I walked in. I'm like, is Maj coming?
Yeah, it doesn't match. I know.
All right, you ready? All right. So anyhow, so I got the data that you guys sent over. What kind of conclusion should I draw from this data?
Well, so you're looking at this, our most recent 2024 report. I mean, let me think about how I want to answer that. It's kind of a double-edged sword, because on one hand you're seeing that the numbers are decreasing, and that's really great, but it really just tells a story. I think that that's like the most important part to understand, because what you're seeing is that really steep increase that we had in drug overdose deaths because of COVID-19, right? And then you're seeing it start to come down, and now we're in this like phase where we question, is this a true decrease because the problem's starting to become solved, or we're working towards solutions, or is this a decrease because this is what normal would look like from pre COVID-19 days? And so really we're trying to figure that answer out too. We know a lot of things that we do are working, but we know there's a lot of work left to be done, so it's hard to make a conclusion from this data.
Well, when you're dealing with drug overdose, you said you've been here like 11 years, and there's a lot of things that you say you do to try to deal with it. So what are you guys doing differently today than you were like 11 years ago?
So we started in 2014 to distribute naloxone. That's when the health department was able to start accessing naloxone and start getting it out to the community. And from there, I mean, we were really limited in those beginning days, and I came on in overdose prevention at the end of 2019. And we were distributing about 2,000 naloxone kits annually. Last year we distributed 18,000. So our work has greatly increased in terms of not just the size of our team, but what we're able to do out in the community, how resources are available to us, and then how we're able to make those available to other people. So it's a lot of community collaboration that we're able to do, and really that all was sparked by COVID-19. Those people that you mentioned, Zach Reed from Toledo Fire and Steve Rogers from DART, those are some of those key players in coming together to build out our coalition to what it is today and how we all work together today. None of us are gatekeepers of anything in terms of resources or data or things like naloxone. So getting it out into the community has been a priority for everyone.
So naloxone, that's Narcan, right? So there's I know that there's strips out there so people can
drug testing strips, yeah.
So do you give people that? I mean, is that a tool too that people have?
Yeah, absolutely. And actually, I don't know if you saw the most recent news, but Governor DeWine on October 1st signed an emergency, what are those things called? An emergency. Yeah, an emergency executive order to actually, so at I think around 2023, fentanyl test strips previously were considered to be drug paraphernalia, and they made it so those are actually legal to have because they're proven to work in identifying drugs in the drug supply that would cause injury or overdose death. And then on October 1st, DeWine signed an emergency executive order to work with the Ohio Board of Pharmacy to make any type of drug testing strip. So things like xylazine, medetomidine, nitazine, different types of opioids or benzodiazepines, those types of drug testing strips are now removed from that paraphernalia list and legal for individuals to have because, again, they're proven to work. They're proven to show people what drugs are in, the substance that they're interested in taking to prevent any type of fatality or injury.
So you mentioned several of the community partners you have. So when people think about the Lucas County Health Department, where do you fit in this wheel of trying to deal with drug overdoses? What's your role?
Our role is definitely to be a pillar of harm reduction in the community. So we're really looking at it from an angle of prevention, but it's prevention of injury and prevention of death. All of our staff are well equipped to make referrals and provide linkages to care, but our lane is the harm reduction provider. So we're distributing things like naloxone. We're working with individuals who use drugs to help get them supplies that they need to stay alive.
So, like, if somebody wants, naloxone, and they're like, "Hey, how's that work?" They just walk in there and say,
Yeah, I mean, naloxone is so widely available. They sell it at like Target and Walmart and Walgreens now, right? So they can come here, they can come get naloxone. They can even get it in our vending machine right outside of the store. So they just come and press a button. It's that easy to get. There's no charge. It's anonymous, and we even have a mail order program, so they can request it to be mailed right to their house too.
does it almost feel like giving people permission to use these drugs, though? If they're like, "Hey, you're gonna use it, but we've got naloxone. We can save you if you overdose."
Well, I don't think so, and I don't think anyone should think so because of how you just started your sentence. Is you're going to use it. They're going to use it anyway. So we're just giving the tools to prevent death and prevent that injury. But naloxone isn't just for people who use drugs. It's also widely used for other people in other circumstances. Anyone who's prescribed an opioid should have naloxone on hand. There are people who forget that they already took their daily prescription for the day. There are people who accidentally get into something that they shouldn't. So naloxone is really for anyone.
So when you look at the numbers, and just talking to Todd yesterday, I mean, and Steve, I mean, we're seeing a lot less fentanyl. Maybe it's just less in the community. We're seeing less overdoses. What do we make of that number? I mean, so fentanyl and opioid overdoses are way down. What do we make of that?
I don't know that they're way down. I think that there's a really significant issue still, so I don't like to speak in terms of like there's a huge decrease. We want to see trends over multiple years, not just a couple of years. So we've really, like I said, is it working towards the solution, or are we just back to what drug rates would be without having a global pandemic? But we do know that some things have changed and grown. In terms of the work that we do, we know that harm reduction is a tool that's widely accessible, that's backed by all 50 states, regardless of political affiliation. Every single state has a rule that makes naloxone accessible to anyone. And so we know that these things have been prioritized, and we can see the evidence of how widespread and saturated the community has been able to get with tools like harm reduction. We've also been able to see all these treatment agencies really thriving over the last couple of years, and so we know that that's something that's widely available, especially here in Lucas County. We have a highly saturated group of treatment providers, which is fantastic. And then we know that there have been changes in the drug supply too. So even though we see fentanyl decrease, we're seeing really concerning trends increase, like methamphetamine, amphetamine. Those are things that are still continuing to increase. Polysubstance use is a huge issue as well. People aren't just going in one direction or the other, where their drug of choice is an opioid or is a stimulant. It's a mix of both. And people can't control the drug supply either. So when people are looking for drugs, they aren't necessarily in control of what they're able to get. And so the problem becomes, what is the problem and how do we solve the problem? And so when we look at things like fentanyl decreasing, it is something that we can look at with a little bit of hope and think, okay, some things are working, but we have to continue to do those things to make sure that those are what is working.
Yeah, and that's really interesting what you said there, because again, Todd was saying the same sort of thing yesterday.
Mm-hmm.
It's like, look, if somebody's a user, they're basically they're going to use whatever they can get their hands on, whether it's like cocaine or heroin or whether it's fentanyl. And there has been a push in this country, obviously, particularly the borders, to try to cut down fentanyl coming in. Steve had mentioned that there's less fentanyl in the community that they're seeing. You know, the Ohio Highway Patrol have a bunch of data. They're not confiscating nearly as much as they once were because there's not as much to confiscate.
Yeah.
But yeah, you're not alone in saying, you know, I've read other articles that people are like, we don't know whether this is the new normal or whether this is just like a 1 year, 2 year hiccup.
Right.
I mean, what do you think? I mean, again, I mean, people are, I'm not holding you to this, but I mean, what do you
No,
think?
that's okay. I honestly, I think the biggest thing is the street supply is so unregulated. You don't know what's in there. You really don't. So what you're getting is never what you think it is because you don't have an ingredient list for what you're getting. And then we see things like xylazine and medetomidine, these tranquilizers that are now being included in this drug supply. So that's taking that little bit of fentanyl that might be in something and stretching it a little bit longer because you're getting a sedative in there. So something that's going to, you know, maybe make you pass out for hours. And so these are all designed to just kind of make people have this experience. And if they like that experience, then they go look for more of that experience, right? So I think that's part of that issue that we're coming up against is people in positions like ours, we are at a loss because we don't know what that street supply looks like all the time. We don't have access to that information. We get information from like State Highway Patrol, and the state of Ohio does a really great job of trying to get those drug trend that data out there to us so we can combat that, but then we need the tools to combat it. So that comes into play with those like drug testing strips so that we can, you know, provide that knowledge to other people to have them understand that there are adulterants in their street drugs, which sounds crazy to begin with. But there are people who don't want those types of things, who are like, that stuff's nasty, I don't want to mess with that, or are scared of it because it causes, like xylazine causes these insane wounds that get really, really like critical overnight. I mean, it's a mess. It really is a mess. So it's really problematic right now, I would say.
I mean, is it challenging? Again, you've been here 11 years, and I'm guessing 11 years ago, I mean, what was the drug of choice 11 years ago?
Well, I was a clerk 11 years ago, so I wasn't in this type of position. But we did go from, you know, prescription medication, which is where this really started when you're looking at the opioid epidemic. So people were getting overprescribed prescription medication. And once that started getting regulated, then they're turning to heroin. Heroin, which is a natural opioid that was able to be easily accessible. Then people found out, oh, I can make fentanyl and I can make it on my own and it can be cheaper and it can go further. And so then it just shifted. And when you look at our data, like if you look at the data that I gave you, that chart, you can see like heroin is all but disappeared. I mean, for the most part, we do see it pop up here or there. But when people say I'm using heroin, I mean, that's not the norm. That's not what you're accessing on the streets. You're accessing something more like fentanyl.
Yeah. Is it challenging as a health department trying to deal with so many shifts in the popular drug?
Yeah.
Yeah.
Yeah, because Narcan only works on opioids too, so that's the other issue we have. You know, our biggest defense against overdose death only works on opioids. So if the shift moves towards methamphetamines and other things, which we know when you're looking at polysubstance use and you're drinking alcohol and doing cocaine, that's causing an even bigger issue that causes death right there. There isn't something in our arsenal that can help prevent that other than trying to get knowledge out there on, you know, when to call for help and when to, you know, have intervention from EMS, from treatment recovery, things like that.
Yeah, so that's a really interesting to me because, again, by the numbers and by Todd's experience, methamphetamines are really kind of jumping up there.
Yeah.
And when you look at the Ohio State Highway Patrol, their confiscation, cocaine is really high. Ohio's a big hot spot for cocaine.
Yeah.
But there's really nothing. Yeah, I mean, there's really, people can take Narcan and it's like, hey, it's going to save me from the opioid. overdose, but
And that's kind of the beauty of programs like ours, so like our Safe Services program, where we're working directly with people who use drugs and trying to engage them with the tools that they need. You know, that's why we look at what are the trends telling us, because right now our main population is working with individuals who use IV drugs, syringes. That's going out the door. Like people are, I mean, a lot of people still are using IV drugs and syringes, but a lot of people are smoking drugs or snorting drugs, and we don't necessarily have the tools to interact with those people. So maybe those people aren't seeing value in our program, they're not connected to a program like ours, and we might be the only service that someone is connected to, someone who uses drugs is connected to, because they've been stigmatized, ostracized, like just completely isolated from community and don't want to access services. So they come to us. And if they don't see value in our program, then they're not coming to us. Now they're not going to anyone. So that's kind of one of those really big things when it comes to the drug supply, where if we're not armed with the tools to help people, I mean, those are people who just aren't going to get help.
yeah. So I'm going to ask you two more questions, and one of them, what's your message to, like, if somebody sees this story and they're like, oh, okay, opioid overdoses are down 35%, drug problem's over, drug crisis is over, because for so many years, I mean, we'd see those headlines every day, opioids, fentanyl, it's like a crisis, you know, president, I mean, government trying to cut down the supply, but now people are going to see, well, we turned the corner, drug crisis is over. What's your message to them?
35% decrease isn't that big of a decrease when we had like a 200% increase before that. You know, so I think that, like I said, when you're looking at this data, you just have to take it with a grain of salt, and you have to understand that we're not out of the woods. This is still a huge problem that impacts areas, especially like Toledo. We do have a drug crisis going on, so we definitely just need to understand that we need to offer, you know, support and understanding and compassion where we can, and hopefully that will lead to better outcomes.
And what's your message to, I am at the bottom, I got a cocaine problem, I don't know where to turn, I feel awful about myself, no one's there to help me, what do I do?
Well, that's a good question. I think it's one of those things where you have to understand that there is so much that has shifted over the last several years. So much focus has been put into efforts to help individuals who are in rock bottom phases of their life. We have done so much work to break down stigma, to provide that helping hand, to reach people in a loving and caring way. And there are a lot of people in this community who are ready to, no questions asked, just help, provide help. People like DART, our DART officers are incredible. They're always welcome around our services because we trust them that much, and they provide so much dignity and respect for people who are in these situations. And when you feel like you're at that low and that no one would provide you with that dignity or respect, like, understand that there are people who still would, and getting in contact with them, people at the Northwest Ohio Safe Services, here at the Health Department, our partners at DART, our partners out in the community with Crisis Cares and the Zeph Center and those treatment agencies are ready to help and ready to do it with dignity, with respect. That is what you deserve. If you are someone who uses drugs, you still deserve all the dignity and all the respect that someone who doesn't gets.
So if I, you know, come in here, I'm like, I don't know where else to go. I walk in the health department. I'm like, I have an awful problem. I'm afraid I'm going to die. I don't want to die. I can't. I need help. What happens?
Well, you're going to be met with our team, those girls over there, and they're just going to try to help you. They really will sit down and try to help you. We have a linkage to care coordinator. We have a nurse. We have a harm reduction health educator. If you're not ready to quit, we work with people who, no one needs to be working towards sobriety to access our services. There's no qualifications. There's nothing that would disqualify you. So we're ready to help.
Okay, that's all I have, unless
Okay.
there's some other message you wanna.
No, just, of course, if you're able to plug, Crisis Cares line or where to get help, Narcan's available, mail order, things like that. I think it's always helpful if you're running something like this, in case there is someone who is at rock bottom watching.
What would be the number you mentioned, Crisis Cares?
Crisis Cares is, it's through the Zeph Center. I have some stuff with it on there. I can give that to you. Yeah.
I'm gonna get a few cutaways.
Okay, can you get what she says there?
Yeah.
I'm looking it up for you.
Okay, thanks. It's it's 904 care. 419 904 care.
2273.
2273. Yeah.
So it's 419.
904 2273 or care. It's through the Zeph Center. They're 24/7 crisis stabilization
Maybe
unit.
just for
Yes,
the
I will.
roll, sorry.
Yep, nope, you're good.
Okay. So 419-904-2273.
Yep. And mail order Narcan is available on our website. And you can live anywhere. We'll just send it out regardless.
Do you need to pay for Narcan?
We pay for it.
No?
We cover the costs.
Yeah, and that's interesting what you said about, it's just not maybe the person that has drug abuse, drug addiction problem. It could be somebody that just has taken opioid, and maybe it's an older person and they're not remembering whether or not they took it.
We've had a guy bring his kid in here to learn how to use Narcan because he was on fentanyl patches, and he was worried that if he was mowing the lawn and it was hot out or something like that happened, that he'd experience an overdose potentially, and that his kid would need to learn how to use it. And honestly, I think that that's the biggest thing, is understanding like how many people overdose and drug use and substance use actually impacts in the community. We go out to schools and do education for, like things like career fairs, and we just have kids stopping us all the time telling about their parents who have substance use problems. Like, why do they deserve to watch their parent suffer? And that is what Narcan's for. I can't ever tell a mom that they have no response to watching their kid or something like that. It's it's for people who care and want to step in and help. And if you can't understand that, that's okay, but there are a lot of people who can understand that and who need to, so.
Yeah. So you said somebody outside is hot and mowing the yard, he's worried he would overdose on the patches. Do the patches, is it because you're sweating or something and it causes?
There are
it
things
to
that can
spread?
impact that absorption rate, and I mean, I'm not a doctor, so I can't really, but he seemed like, I mean, if that's your concern, that's your concern. It's better to have it than not have it, if that is something that can happen or not. I've never used a fentanyl patch, but
Yeah, I've never
I know
been
that people-
around Narcan, so you just spray it, right? I don't
yeah,
hear
it's just a
what it
nasal
is.
spray. Yeah, and it's kind of cool too, because I start to see, so like when Narcan first came out, they actually had that nasal spray design patented. And so Narcan was the only brand of nasal spray naloxone.
Yeah.
But then once that patent, ran out, now we have several brands in generic nasal spray. And now you even have like epinephrine nasal spray, because that design was patented. They couldn't do anything with it, so that's kind of cool.
Would you actually have them handy?
Yeah.
That we can,
Oh my gosh, yeah.
or strips?
Sure
or
can. They're,
anything?
yeah,
Just
let's
give-
go get them right out of the
can I get
vending
a few more
machine.
shots real quick?
Yeah.
Just keep talking.
'Cause it might be good. just,
Oh, I'm gonna
to
take her
report it.
password information away, sorry. But yeah, absolutely, we can. I carry it in my purse. I mean, I recommend people carry it. I've had my friend who's gotten it from here. She was driving on Summit Street one day, and saw someone laying on the ground, and she just had a feeling they were overdosing. She grabbed her Narcan, ran out, and was able to give it to them before EMS got there, and so he was up and talking by the time EMS got there.
Wow. So Narcan just works for opiates, right?
Yeah, that's its only
So,
jobs
if
too.
you're
So
spraying somebody overdosed on cocaine or something, it's not gonna
If
necessarily do anything.
you wouldn't have the same